Have you ever noticed yourself clearing your throat over and over again throughout the day? Maybe it's first thing in the morning. Maybe it happens while you're talking with friends, watching television, or even sitting quietly with a cup of coffee. You clear your throat, and for a moment it feels better. Then, just a few minutes later, you have to do it again. Many people assume it's just mucus or part of getting older, but that's not always the case. Constant throat clearing can be your body's way of telling you that something else is going on. Sometimes it's harmless. Other times, it's linked to a condition that can be treated once you know what to look for. Today, I'm going to explain the most common reasons this happens, especially after the age of 60, and I'll share simple, practical steps that may help you finally understand what's causing it. If you enjoy easy-to-understand health advice designed to help you stay active and healthy as you age, consider subscribing to Vital Health Insights and join our growing community. Let's get started. One of the questions I hear most often from my older patients is, "Doctor, why do I keep clearing my throat all day?" It's a good question because many people live with this problem for months or even years without knowing the real reason. Some carry cough drops everywhere they go. Others sip water constantly. Some even believe they simply have too much mucus. But in many cases, mucus is only part of the story. Your throat is one of the most sensitive areas in your body. Tiny nerves constantly monitor what's happening every time you swallow, breathe, or speak. Even a small amount of irritation can trigger the urge to clear your throat. The problem is that clearing your throat again and again can actually make the irritation worse. Think about rubbing your skin after a mosquito bite. It may feel good for a few seconds, but the more you scratch, the more irritated the skin becomes. Your throat often works the same way. Each forceful throat clear causes your vocal cords to slam together. Once or twice isn't a problem. Hundreds of times every day can create more irritation, leading to even more throat clearing. Can you see how this becomes a cycle? The irritation causes throat clearing. The throat clearing causes more irritation. Then the cycle continues. Breaking that cycle starts with understanding what's causing it. So let's look at the first, and probably the most common cause. Hidden cause. Number 1. Postnasal drip. Have you ever felt like something is slowly running down the back of your throat? That's called postnasal drip. Your nose naturally produces mucus every single day. Most people never notice it because they swallow it without thinking. But when your body starts producing extra mucus, or when the mucus becomes thicker than normal, you begin to feel it collecting in the back of your throat. Your first reaction is usually to clear your throat. After age 60, this becomes much more common. The tiny hair-like structures inside the nose don't move mucus as efficiently as they once did. At the same time, seasonal allergies, sinus irritation, and changes in humidity can all affect the thickness of mucus. Many people notice the problem is worse in the morning. Have you ever woken up feeling like you need to clear your throat several times before your voice sounds normal? That's a classic pattern. While you're sleeping, mucus has several hours to collect. When you stand up in the morning, gravity helps it move downward, creating that familiar tickle. Some people assume they have an infection. Often they don't. It may simply be normal mucus that's become thicker or isn't draining efficiently. Fortunately, there are several simple habits that may help. Staying well hydrated is one of the easiest. Water helps keep mucus thinner, making it easier for your body to clear naturally. Using a saline nasal spray can also help moisturize the nasal passages without medication. If allergies are contributing to the problem, identifying and reducing exposure to triggers may also make a difference. Do you notice that your throat feels worse during pollen season or after cleaning a dusty room? Small clues like these can help identify the cause. But postnasal drip isn't the only reason people constantly clear their throat. There's another condition that's even more surprising because many people don't realize they have it. Hidden cause number 2, silent acid reflux. Most people think acid reflux always causes heartburn, but that's not true. In fact, many older adults have a form of reflux called laryngopharyngeal reflux, often shortened to LPR. Many doctors simply call it silent reflux. Unlike traditional acid reflux, silent reflux often doesn't produce the burning sensation in your chest. Instead, small amounts of stomach contents travel upward and reach the throat. The lining of your throat is much more delicate than your stomach. Even tiny amounts of acid or digestive enzymes can irritate it. The result? A constant feeling that something is stuck in your throat, frequent throat clearing, a hoarse voice, a dry cough, sometimes even the sensation of a lump that isn't really there. Many patients are surprised when I explain this. They tell me, "But doctor, I never get heartburn." That's exactly why silent reflux is so often overlooked. Have you noticed your throat feels worse after eating a large dinner, or perhaps after drinking coffee or lying down shortly after a meal? Those are important clues. Simple lifestyle changes often help. Eating smaller evening meals, avoiding lying down for at least 2 to 3 hours after dinner, maintaining a healthy weight if recommended by your healthcare provider, and identifying foods that seem to trigger symptoms. Not everyone has the same triggers. For some people it's spicy food. For others it's chocolate, peppermint, alcohol, or caffeinated drinks. Keeping a simple diary for a week can sometimes reveal patterns you never noticed before. The important thing is not to ignore symptoms that continue for weeks. If throat clearing persists despite simple changes, your healthcare professional may recommend further evaluation to determine whether silent reflux is playing a role. And believe it or not, there's another common cause that many people underestimate because it seems so ordinary. We'll talk about that next. It may be affecting you every single day without you realizing it. Let quote S continue with another reason many people never suspect. If I asked you right now, how much water did you drink yesterday? Would you know the answer? Most people over 60 don't. Some intentionally drink less because they don't want to wake up during the night to use the bathroom. Others simply don't feel thirsty as often as they did when they were younger. But this natural change can quietly affect your throat every single day. Hidden cause. Number 3, dry throat and dehydration. Your throat depends on a thin layer of moisture to stay healthy. Think of it as a protective coating. Every time you swallow, speak, laugh, or breathe, that moisture helps reduce friction and keeps the delicate tissues comfortable. When your body doesn't have enough fluid, that protective layer becomes thinner. The result? Your throat may feel rough, scratchy, or irritated. Instead of pain, many people notice something different. They feel as if something is stuck in their throat, even when nothing is there. Naturally, they clear their throat again and again, hoping the feeling will disappear. Have you ever noticed your throat feels worse after sleeping, after spending time in an air-conditioned room, or during cold winter weather when indoor heating is running? Those situations often dry out the air you breathe. The tissues inside your nose and throat lose moisture more quickly, making irritation much more likely. Age also plays a role. As we grow older, our sense of thirst becomes less reliable. Your body may already need water before you actually feel thirsty. Some medications can make this even worse by causing dry mouth or reducing saliva production. That's why many older adults experience dry lips, a dry mouth, and frequent throat clearing at the same time. Fortunately, this is one of the easiest causes to improve. Rather than drinking a large amount of water all at once, try sipping fluids regularly throughout the day. Keep a bottle of water nearby while reading, watching television, or spending time outside. If your home feels very dry, especially during winter, a humidifier may help add moisture to the air while you sleep. Some people also find that sugar-free lozenges or chewing sugar-free gum encourage saliva production, helping keep the throat comfortable. Here's a simple question. The next time you feel the urge to clear your throat, try taking a slow sip of water first. Does the feeling improve? If it does, dryness may be playing a larger role than you realized. Of course, dehydration isn't the only reason. Many people constantly clear their throat because their immune system is reacting to something in their environment. Let's talk about that next. Hidden cause number 4, allergies. When most people think about allergies, they picture sneezing, itchy eyes, or a runny nose. But allergies don't always look like that. In many older adults, the main symptom is constant throat clearing. Every day, you breathe in tiny particles from the world around you. Pollen, dust mites, pet dander, mold spores, even certain perfumes or cleaning products. For some people, the immune system mistakenly treats these harmless substances as dangerous. The body responds by producing chemicals such as histamine. Those chemicals increase mucus production and can irritate the nose and throat. That irritation often creates the feeling that something needs to be cleared away. Have you ever noticed your symptoms are worse after gardening, or after vacuuming, or perhaps when visiting someone who owns cats or dogs? Those small details can provide valuable clues. Sometimes allergies change over time. You may not have struggled with them when you were younger. That doesn't mean they can't appear later in life. The good news is that identifying triggers can often reduce symptoms dramatically. For example, washing bedding regularly in hot water can reduce dust mites. Using high-quality air filters may improve indoor air quality. Keeping windows closed during high pollen days may also help if seasonal allergies are a problem. Some people benefit from allergy medications recommended by their healthcare provider. However, it's important to choose carefully. Certain older antihistamines can cause drowsiness, confusion, or increase the risk of falls in older adults. If you think allergies may be contributing to your symptoms, discuss the safest treatment options with your healthcare professional. Here's something else to consider. Do your symptoms improve when you're away from home? Or do they become worse in one particular room? Those observations can sometimes reveal an environmental trigger that has been there all along. But allergies aren't always the answer. Sometimes the very medications helping one health condition may unintentionally affect your throat. Hidden cause number 5, medication side effects. This surprise catches many people off guard. They've been taking the same medication for months or even years. They never imagine it could be connected to their throat. Now, this doesn't mean medications are bad. Many are life-saving and should never be stopped without medical advice. But like all treatments, they can sometimes produce side effects. One well-known example involves a group of blood pressure medications called ACE inhibitors. These medicines help millions of people control high blood pressure and protect the heart. However, in some individuals they can cause a persistent dry cough. That cough often leads to repeated throat clearing. Other medications may reduce saliva production. Certain medicines for allergies, depression, anxiety, bladder problems, or Parkinson's disease can sometimes leave the mouth and throat feeling unusually dry. When saliva decreases, irritation often increases. The result is another cycle of throat clearing. Have you started a new medication within the past few months? Did the throat clearing begin around the same time? Those are important questions worth discussing with your healthcare provider. Never stop a prescribed medication on your own. Instead, ask whether your symptoms could be related to your treatment. Sometimes a simple adjustment or an alternative medication may solve the problem while continuing to treat the original condition safely. Your healthcare provider can help decide whether that's appropriate. It's also worth remembering that not every symptom has only one cause. Many older adults experience 2 or even 3 contributing factors at the same time. For example, someone may have mild allergies, slight dehydration, and silent reflux together. Each problem alone may seem small. Combined, they can create persistent throat irritation throughout the day. That's why looking at the whole picture is so important. The next hidden cause has nothing to do with mucus, allergies, or stomach acid. In fact, it begins with something most of us do every day without thinking. We use our voice. And over time, the way we use it can have a surprising effect on our throat. Let quote S continue with one final hidden cause that many people overlook. Hidden cause. Number 6, voice strain. Your voice is something you probably don't think about very often until it starts causing problems. Every time you speak, 2 small bands of tissue inside your voice box, called the vocal cords, gently come together and vibrate to produce sound. It's an amazing process that happens thousands of times every day without you even noticing. But just like any other part of your body, these tissues can become irritated if they're overworked. Some people naturally speak loudly because of hearing loss. Others spend hours talking on the phone, chatting with friends, singing in church, teaching, or caring for grandchildren. Even talking in a noisy restaurant can make you raise your voice without realizing it. Over time, this extra effort can irritate the vocal cords. Instead of feeling pain, many people notice something much more subtle. Their throat feels scratchy. Their voice sounds slightly hoarse. They constantly feel the need to clear their throat before speaking. Does that sound familiar? Here's the important part. Repeated throat clearing actually slams the vocal cords together with considerable force. It's almost like clapping your hands hundreds of times every day. Eventually, the tissues become swollen and even more sensitive. Then the cycle begins again. You clear your throat because it feels irritated. But clearing your throat creates even more irritation. Many people never realize they're trapped in this cycle. Fortunately, there are healthier ways to respond. Instead of forcefully clearing your throat, try swallowing first. If that doesn't help, take a small sip of water. Some speech therapists even recommend a gentle cough instead of a harsh throat clear because it places less stress on the vocal cords. If your voice frequently becomes hoarse or tired after talking, giving it short periods of rest throughout the day can also help. Think of your voice like any other muscle. It benefits from balance. Using it is healthy. Overusing it without rest can lead to irritation. Now that we've covered the 6 most common hidden causes, let's talk about practical habits that may help reduce throat clearing regardless of the underlying reason. Simple daily habits that can help. The good news is that many people begin feeling better by making small, consistent changes. You don't need a complicated routine. Often, simple habits practiced every day can make a noticeable difference. First, stay hydrated. Instead of waiting until you're thirsty, sip water regularly throughout the day. Your throat functions best when it's well moisturized. Second, pay attention to your meals. If you notice your symptoms become worse after eating large dinners, spicy foods, chocolate, peppermint, coffee, or alcohol, consider reducing those triggers, especially in the evening. Avoid lying down immediately after eating. Giving your stomach 2 to 3 hours before bedtime may reduce irritation caused by silent reflux. Third, think about the air in your home. Dry indoor air can irritate the nose and throat. If your home becomes very dry during winter, adding moisture with a humidifier may improve comfort. Fourth, breathe through your nose whenever possible. Your nose naturally warms, filters, and humidifies the air before it reaches your throat. Breathing through your mouth bypasses that protection, often leading to dryness. If nasal congestion makes nose breathing difficult, discussing the cause with your healthcare provider may help. Fifth, avoid smoking and secondhand smoke whenever possible. Smoke irritates the delicate tissues lining the throat and increases inflammation. Even occasional exposure can make symptoms worse. Finally, be patient. Your throat may need several weeks to recover after the irritation cycle is broken. Many people expect improvement overnight. Healing usually happens gradually. Small improvements each week often add up to significant progress over time. When should you see a healthcare professional? Most cases of throat clearing are not caused by a serious illness. However, there are times when the symptoms should never be ignored. If your throat clearing continues for more than 3 or 4 weeks despite simple lifestyle changes, it's time to schedule an evaluation. You should also seek medical attention if you notice difficulty swallowing food or liquids, pain when swallowing, coughing up blood, a lump in your neck, unexplained weight loss, persistent hoarseness lasting longer than 3 weeks, chest pain or difficulty breathing, frequent choking while eating. These symptoms do not automatically mean something serious is wrong, but they do deserve prompt medical evaluation. Your healthcare provider may examine your throat, review your medications, ask about allergies and reflux symptoms, or recommend additional testing if necessary. Sometimes a referral to an ear, nose, and throat specialist, also called an ENT doctor, is the best next step. The important thing is not to ignore symptoms that continue to worsen or refuse to improve. Early evaluation often leads to simpler treatment and greater peace of mind. A few common myths. Before we finish, I'd like to clear up a few common misunderstandings. Myth number 1. Constant throat clearing means I have too much mucus. Not always. Sometimes the sensation comes from irritation rather than excess mucus. Myth number 2. If I keep clearing my throat, eventually it will feel better. Unfortunately, the opposite is often true. Repeated throat clearing may prolong the irritation. Myth number 3. It's just part of getting older. While aging can contribute to throat changes, constant throat clearing should never simply be accepted without trying to understand the reason. Many causes are manageable once they're identified. Knowledge is one of the best tools we have for protecting our health. Final summary. Let's quickly review what we've learned today. If you constantly need to clear your throat, don't assume it's just mucus. The most common hidden causes include postnasal drip, silent acid reflux, also called laryngopharyngeal reflux, allergies, dry throat and dehydration, medication side effects, voice strain. In many cases, simple lifestyle changes such as staying hydrated, avoiding late-night meals, reducing throat clearing, identifying allergy triggers, and protecting your voice can make a meaningful difference. But remember, persistent symptoms deserve proper medical attention, especially if they're accompanied by warning signs like difficulty swallowing, coughing up blood, unexplained weight loss, or lasting hoarseness. Your throat works hard every single day. It helps you breathe, speak, swallow, laugh, sing, and connect with the people you love. Taking care of it is one small investment that can improve your comfort and quality of life. If today's video helped you better understand why you keep clearing your throat, I'd love to hear from you. Have you experienced any of these symptoms? Which of the hidden causes surprised you the most? Share your thoughts in the comments below. Your experience may help someone else who is going through the same thing. And if you enjoy practical, evidence-informed health advice designed especially for adults over 50, please take a moment to like this video, subscribe to Vital Health Insights, and turn on notifications so you don't miss future videos. Finally, remember that this video is for educational purposes and should not replace personalized medical care. If your symptoms persist, worsen, or concern you, Please schedule an appointment with your healthcare professional for an evaluation tailored to your individual needs. I'm Dr. Andrew Parker, and thank you for watching Vital Health Insights. Stay healthy, stay informed, and I'll see you in the next video.